In the dental field, there are many different things that come along with working in an office. When you go in to get your teeth cleaned, they use scalers and perio instruments and explorers to clean your teeth and get all the gross stuff off of them. When they polish your teeth, they use the little handpiece, and a prophy angle goes on top of the handpiece. We use a different prophy angle every time for every patient for sanitation purposes. And when they dip it in that green paste, or whatever color it may be, that is called prophy paste. And it's kind of gritty and it just polishes your teeth up. If you go in for further work, such as a filling, a root canal, a crown, an implant, or getting a tooth pulled, which is known as an extraction, there are many more instruments involved in these things. They also use handpieces, and the handpieces, like the prophy angles, are powered by air. They step on a pedal, which is behind the chair usually that the patient sits in, and when they step on that, it sends air at very high speeds through the handpiece, and that causes whatever it is to spin, whether it's the burr or what they're polishing your teeth with. In order to fill a cavity, they drill the tooth out and get all of the decay out and then put the filling in. There are two types of filling. The white tooth-colored filling is known as resin composite. When you do a composite filling, there are many different steps involved. You take all the decay out of the tooth and then you put what's called the bonding resin in. You light cure that with a light that is blue in color, and it uses UV wavelengths to set this material up. Then you use what's called flowable composite. It's more of a liquid form that is in a syringe. Lastly, you use what's called the regular composite, and it's more putty, and you squish it down into the tooth and form it to what you're filling. You also light cure that until it sets hard. The other type of filling is known as amalgam, which is the silver filling. This is one step. You mix up the amalgam, and then you pack it into one of the instruments, and then push that from the instrument into the tooth and pack it down until it forms flat or contours to the tooth. If you are going to do a crown, what you do is use the handpiece and burrs, which are like the drill bits, to cut the tooth down. And when you do this, you go 1 millimeter to 1.5 millimeters around the tooth, and 1.5 millimeters to 2 millimeters down the top of the tooth in order to fit the cap over the top of it. Usually crowns are done if the tooth is cracked in order to keep it from breaking further. If you go in for a root canal, they drill out the center of your tooth, find all of the canals. On the front teeth there is only one canal. On the back teeth, sometimes bicuspids have two. The back teeth usually have three. Sometimes they have a fourth root that goes off. So you have to make sure that you find all of the roots, and you clean those out with files. The files are different sizes to clean everything all the way out. And then you fill the roots with gutta percha and then fill the rest of the tooth. After a root canal, it is usually recommended to get a crown, because taking the nerves out of the canals takes all blood supply away from the tooth, which makes it brittle, and they usually break easier. Root canals are done if there is trauma that has involved the tooth and one of the nerves is dying, or if there's an abscess, and when that happens, you get fluid at the top of your gun, at the end of the root of the tooth, and it like bubbles up like pus and stuff, like a normal infection would be. An implant is something that replaces a missing tooth. These are amazing things. It's titanium, and they drill down into your jawbone and put the abutment in there, which screws into your jawbone, and then at another appointment, after that heals a little bit, they put a crown into the implant, so it just completely replaces a tooth. It's durable, it's good for the bone. I mean, it doesn't cause any issues in your jawbone. We do bridges, which are similar to crowns, but also replace a tooth. Wherever the missing tooth is, you cap the two teeth around them, and the bridge is the middle tooth that just hangs there where the other tooth was. When we pull a tooth, there are many instruments involved in these also. There are elevators, which look like screwdrivers, but they get under the tooth and can pull the roots and everything out. And then there are forceps, which obviously is what grabs the tooth in order to pull it. Working in a dental office, there are many steps not only to working on patients, but also to sterilization. First, after working on a patient, we put the instruments in what's called an ultrasonic, which shakes all of the gross stuff off of them. Then we put them in the autoclave to sterilize. The autoclave gets hotter than 300 degrees in order to get everything clean. We have to use certain things to wipe the rooms down so that it kills all germs and possible diseases. There is a lot more that goes on in a dentist's office than people realize, and it's a very meticulous place to work.